This portion of the videos is going to go over how we set up our instrument table. The circulating nurse will be the person who actually opens up your instrument pack. One of the important concepts, if you're ever doing this, is to ensure that you're only grabbing the drape from the outside, never grabbing the surface that is the inside sterile surface. In this situation, as you can see, the instrument packs are actually wrapped in a drape that's actually big enough to fit the entire instrument table. What you want to ensure is that all four corners are covered so there's no exposed metal. That's the most important aspect of this. Once you have your instrument table ready to go, you can then come over to the table and begin kind of placing your instruments in the way they should be. Now, some important concepts is that the sterile table is just that, a sterile table. Nothing that is unsterile should even cross its path, whether it is a assistant reaching across that drops suture or something like that. So make sure that only things that are sterile are placed on. Okay, now we're going to go over some of the basic instruments on the table. As you can see here, we have our scalpel blades already loaded onto our Bard Parker scalpel. We also have our basin, and also I want you to realize that we have a tray. And the tray is where we're going to keep most of our sharps. You can see here that my sharps are already contained with the points onto the table. I also have my Kellys and my mosquitoes here, as well as my Alice tissue forceps. All are arranged nicely to make sure that they stay on the table. This is my sponge forceps. The whole goal of this instrument right here is actually just to grab a sponge and to go ahead and blot, let's say, the ovarian pedicle to make sure there's no bleeding. You just place it like that. It's a lot smaller than your hand is, and it fits very nicely into the abdomen. Some of the other instruments that we have in your basic pack are your needle drivers. This is the standard one you'll use. We also have various tissue forceps. You'll potentially have a Adsin, brown Adsin, or a rat tooth, or a DeBakey. We also have 6 small and 4 large towel clamps. You will be using these. The backhouse towel clamps are ones we'll probably be using in the patients. This is a Parker retractor and 2 Army Navy retractors. These guys will be used to help with the body wall, and of course your light handle, which is the last thing you'll be putting on your patient. So that's the last thing you do. Counting your sponges and making sure that they're all there is important to understand. You can count them when they're in the pack like this, individually or in twos. You do not have to take the wrapper off and count them one by one in a pile on the table. So be mindful of how your table looks. Doing something like this, where you're just stamping them like a deck of cards, does not make for a very orderly table. So make sure that you make them in a way you can count them quickly and have your table not in a mess. Your suture, last things that will also be packed onto your table, so these will be passed off from one of your assistants. The last 2 points I quickly want to make is how we pass suture onto the table, or there is anything else that might be passed to you from a non-sterile person to a sterile person. There's 2 ways to pass suture on. The first way is with a nursing assistant to go ahead and drop it on your table. The most important thing is to ensure that she does not reach over your sterile field. You have to remember that this is something you protect, and you don't want the non-sterile arms of your assistant or anyone else around you to drape over the table. So when she does this, she's going to come close to the table, but she's going to make sure that it kind of drops to the corner and is controlled. So you'll see here, this technique is one of the more common ways that they're passed on. She'll go ahead and just drop it very carefully like so. Now, once you have this, you can put the suture obviously anywhere you want on the table. Now, the other way to do this is a much more controlled technique. This is something that I think I would recommend for most of the students that are beginning to work with small animals. It uses your needle driver or a Kelly hemostat to grab the suture sterilely. As you can see here, the assistant has the pack of suture open, and I can go ahead and grab it very nicely and control it and bring it onto my table. That way, no one has to be even in close contact with a non-sterile person.